All right, more stories now. Increased brain drain, unfortunate deaths of doctors and patients, cancer scares, and abuse of drugs, amongst others, are the issues that took the headlines on Nigeria's health sector. On the bright side, the sector also benefited from the success of science, with the rollout of vaccines, which seeks to end increased mortality and women's healthcare in this part of the world. Adesewa Odusoga takes us through timelines of events that shaped the year 2023 in the health sector.
The year 2023 wasn't all rosy for Nigeria's health sector, which recorded strikes, death of medical personnel, as well as massive exodus of health professionals from the country. As of 2022, the Nigerian health sector had lost over 10,000 doctors from its pool recording from the last 7 years, with over 85% of those left still planning to leave. Some of the factors contributing to this brain drain are lack of funding, working conditions, infrastructure, insecurity, and general state of the nation.
The country is in a terrible state. The investment in the healthcare sector is abysmal. It's tragic, right? So you don't expect doctors to thrive in this kind of condition.
The year also witnessed a major cancer scare in the food industry, when the National Agency for Food and Drug Administration and Control launched an investigation following the detection of ethylene oxide said to be potentially cancer-causing in Indomie's special chicken-flavored noodles. These reports raised fears among Nigerians, who are one of the highest consumers of noodles globally. News Central TV contacted the Director General of NAFDAC, Professor Mojisola Adeyeye, who cleared the air during a phone conversation.
The Taiwan and Malaysian noodles that are in question have nothing to do with the locally made noodles in Nigeria. The federal government placed an importation ban, prohibition list, or prohibition rather, on noodles from different countries many years ago.
On July 26, the National Association of Resident Doctors again embarked on an indefinite strike over the failure of the government to meet the demands of its members.
This was based on the fact that we have very crippling brain drain occurring in Nigeria, and also one of the major factors is financing and wages for our doctors. We've asked for a review of our salary structure called Commerce, and we have not been called as an association or involved in any negotiation.
In the same month, a Nigerian doctor raised an alarm on X platform over the new trend of abuse of nitrous oxide. This is popularly known as laughing gas.
It's toxic to your brain and the spinal cord. If you look at that thread, I attached stories of people that had paralysis. It can cause anemia and drop the blood cells, coupled with things like sudden death, heart attacks, and a lot of that. So it's a lot of things. And I think we need to be worried.
In August, the Nigeria Center for Disease and Control debunked a scare of the new variant of COVID-19 virus known as the SARS-CoV-2. NCDC made a public notice that the subvariants are not present in the country just yet, but virologists called for the expansion of the surveillance system to curtail the likely spread and track new variants.
We should look at animals, we should look at wastewater from hospital, from everywhere, so that we can easily curtail the spread of this variant.
One of the major stories that shook the health sector in 2023 was medical negligence. This was headlined by the report of the missing intestine of a 14-year-old in Lagos and the death of another woman in Delta State following the surgery of appendicitis.
My wife's belly was gotten swollen. No, she did not stool. She did not gas for 2 weeks. Phone rang from Lily Hospital, Benin. Then I said, Mr. Festus, please check your email. Your result for the MRI scan is out. Thank God I was at God Bless Pharmacy. Immediately I just opened the email and I showed the pharmacist. The woman quickly sound like this. I said, hey, they don't forget something for your wife. But
The year also recorded the unfortunate deaths of doctors like Dr. Waridiaso and Dr. Umo Michael, who died due to poor working facilities and overstretched working hours, respectively.
I call him mother because she was murdered while she's at work with the elevator crash, which affected all of us in the health sector in Lagos State. All of us were sad, were crying, were in deep tears because I saw her body personally, and nobody should die like that.
The year equally recorded great feats in science with the rollout of vaccines for malaria and HPV for the prevention of cervical cancer. The rollout of HPV vaccine was welcomed by advocacies, vaccine hesitancy, as well as conspiracy theories.
As a malaria researcher, I used to dream of the day when we would have a safe and effective vaccine against malaria. Now we have two.
As we cross over to the new year, one of the major concerns of the health sector in Nigeria is the lack of funding and inadequate budgetary allocation, expected at 15%, falling short of the Abuja Declaration of 2001 by other African leaders. The funding challenge can be said to be one of the causal factors of brain drain, death of doctors, increased mortality as a result of medical negligence, and inadequate health service in the country. There is also a need for public-private partnerships to put an end to medical tourism, with a record of billions of dollars annually. Adesewa Odusoga, reporting for News Central.